I think probably the hardest thing, I always think it's a bit like bobbing. You have to clearly have a plan, but you have to be incredibly flexible and tough and resilient at the same time. So I think when things aren't going according to plan, it's sometimes quite hard to just say, okay, that's fine, let's try another tactic.
In the current climate, it is about being responsible for multiple different challenging things all at once, and none of them being able to be neglected. So it's about integrating a compassionate leadership of an organisation to engage people at the same time as making sure the financial performance and the activity performance and the quality standards are all being met.
It's about recognising no 2 days are the same. That ultimately there's lots of expectation placed on your shoulders. Now you have to work through other people. And I guess where you have a passion for delivery of high quality care, it's difficult not to feel personally responsible when things don't go well.
I think it's that step away from clinical work. There's a time when you feel ready for it and you know inside that you're happy to give up clinical work. So I was a very busy clinician for 25 years. I think nobody would have guessed I'd end up giving that up to be a medical director, but actually at that time in my career it was the right thing to do, and use all that experience to try and change the system for a lot of people, not just the hundreds of patients I see every year, but that bigger healthcare system.
Taking on a leadership role within their own team, I think, is the most difficult job. And I think if you're up at the next rung at the clinical director or divisional director levels and still working in the area that you're managing, I think that can be very difficult as well, because you are then leading and managing your direct colleagues.